The biggest question we get when we see patients and we diagnose them is what's the difference between a disc bulge or a herniated disc? And this is even different from provider to provider because not a lot of doctors do the evidence-based research and imaging to make sure they diagnose it properly. The only way to truly diagnose a herniated disc or a disc bulge is via MRI. Okay, that truly gives us the amount of imaging to see the tissue and the anatomy of how it's affecting your body. The difference between them is a bulge disc is when the disc comes out of its normal place all the way around. Okay, a herniated disc, okay, is if you can see here, that red area, that's actually the part of the inside of the disc, what we call the nucleus pulposus or the annulus. And this is when there's some kind of trauma or a bad habit, the red, as you can see, is coming out. A herniated disc is a focal point area in which the disc is protruding, extruding, or sequestered out of the disc. And I'll explain those three here, okay? So a protrusion is kind of like a mound, okay? The disc is slowly coming out. It's still attached, but it looks like kind of like a mole head coming out of the ground. That can put pressure on that nerve, which can cause numbness and tingling and create spatial issues for those nerves to communicate and can cause a lot of pain. That's called a disc protrusion. Another one is a extrusion. So in essence, it's more like a mushroom. So the outer part is bigger than it is closer to where it came out. So picture a mushroom, okay? So it's bigger on the top part than it is where it actually came out of the disc. That's called an extrusion type disc herniation. And the third type is an sequestered disc herniation. In essence, the red, and I don't have a model of it, but the red is actually completely broken off, floating in free space. That is significant and immediate surgical consult. Now, each three of them, a protrusion, 99% of chiropractors can treat that with the proper diagnosis and imaging. Extruded disc, 50% of those can be treated via chiropractic and the modalities we have in our practice and doesn't need surgical consult. The other 50% will need a surgical consult. And a sequestered disc, when this is completely broken off, 100% of those should be referred out and seen by some kind of neurosurgeon for a surgical consult. The difference between a herniated disc and a bulge disc are quite similar in terms of symptomatology. But we do see with herniated disc, the symptoms are more severe because it's putting more issues in this, what we call a space occupying lesion. So again, we call it a herniated disc, but that there is tissue or anatomy that's not supposed to be where it's intended to be. So for example, when you break your arm and the bone is in a different place than it's supposed to be, that can cause a lot of tissue damage, inflammation, things like that. But we're looking at it from a microscopic level in the spine, and those nerves are extremely critical to the very daily functions of your body. And so that can make the symptoms much more severe. And what we see most often is people can have a disc bulge for a long period of time, and then all of a sudden one morning they wake up and they have a herniated disc. And what that means is that tissue is finally broke down so much that literally, here's a bulging disc, and then boom, the herniated disc finally happens. And we had it just last week. The person came in our office, "Doc, I've had a bulge disc for 15 years, and all of a sudden I just woke up yesterday and I have extreme pain." We did an MRI and we found that we had an old disc bulge, which then turned into a new herniated disc.